Alors, bonjour à tous,
So hello everyone, ladies and gentlemen, dear colleagues. Welcome to this press conference to go over the situation in Quebec for COVID-19. The Premier of Quebec, Mr. François Legault, is together today with the Minister Responsible for Seniors and Caregivers, Ms. Marguerite Blais, as well as the National Director of Public Health, Dr. Horatio Arruda. Mr. Premier. Hello, everyone. I will start with the numbers of the past day. Unfortunately, we have 118 new deaths for a total of 2,398. Of course, my thoughts go to the families and loved ones of those victims. We now have 33,417 confirmed cases, an increase of 794. 1,821 people hospitalized, an increase of 49, and we still have 218 people in ICU, the same number as yesterday. The main problem that we are still encountering today is the lack of staff, particularly full-time staff. We are now, unfortunately, in the entire health network, we are at 11,200 people who are absent, either because they are infected or at risk of being infected or out of fear of being infected. So, of course, I don't need to tell you that that puts enormous pressure on the network as a whole, and not just CHSLDs, but hospitals as well. So a lot of people are absent, and to that must be added the fact that there are many people as well who are present but not full-time. So the situation is still worse, is even worse than the 11,200, pretty much. So obviously this is not an ideal situation to be able to limit the number of contacts with residents. Since there are part-time people, that means that there are more people who are having contacts with each of the residents. So in the case of the spread of the virus, it's not an ideal situation. And of course, the fact that there are 11,200 employees who are absent and people working part-time puts huge pressure on the employees who are working. So long working hours, overtime, no possibility very often of taking time off. So I'm launching a call out again today, first to those employees who have finished their quarantine, because about a third out of the 11,200 technically could come back. So I am calling out to those people. We are like in a war, and as we are waging a war, we need you more than ever. I'm also calling out to people who don't necessarily have qualifications, but who could come and help us. In CHSLDs, for example, it would allow us to send people and to send some of those people back to hospitals, so to balance things out in the network in a better way. I'd like to tell you as well that I gave a mandate to the President of the Treasury Council to elaborate new premiums to convince more employees, more people outside of the network to come and work full-time. I really wish for us to concentrate on full-time work, which represents a certain number of hours per month, and that is important that we have stability. Of course, it's nothing simple. We already have premiums that have been set up. We have to be certain by putting premiums in the public sector that we don't, remove resources from the private sector either. So that is why we are looking at the entire file as a whole with Christian Dubé, and we should be able to quickly, I hope even by tomorrow, to be able to announce new premiums so that we can convince more employees to work full-time in the health network. It is something that is absolutely necessary to be able to get what we need. I'm happy today to have the Minister Responsible for Seniors and Caregivers with me today. Marguerite continues following the situation very closely. It's difficult to make miracles with the number of employees who are absent in the network. And there's a small order that I had given her as well a few days ago of saying, you'll remember right from the beginning of the crisis, we said we have to limit the ins and outs in the residences for the elderly to avoid that too many people get affected. A few weeks ago, we asked the management of the different residences to allow caregivers to come see their parents. Unfortunately, and very often you are the ones that tell us of it, the journalists, there are certain residences where management does not allow, for all sorts of good or bad reasons, does not allow caregivers to come and see their loved ones. I think that both Marguerite and myself find that that is not human, that for a 2-month period somebody was not able to see their children. It makes no sense. I understand the reason why this is being done. People want to avoid the spread of the virus, so there's a wish to protect the physical health of people, but we can't protect physical health at the detriment of mental health. And that is why I've asked Marguerite to take great means. She will explaining how and when she'll be doing this, but we want to make sure that it becomes a basic rule, that caregivers be accepted, even if we have to set up procedures such as the ones that Marguerite will be explaining to you. And on the other hand, I also asked Dr. Arruda to see whether we might allow people going out. Because right now, there are people, it's been 2 months that they haven't been out of the residences. And once again, this is very hard on mental health. And I think it is important to, have a bowl of fresh air. And Dr. Arruda agrees with that. So Dr. Arruda will be explaining to you the rules that we wish to set up in order to be able to allow people to go out and get some fresh air more, to get out of the residences a little and to get a little bit of freedom back, which is primordial for their mental balance. So, I will then give the mic to Marguerite and Dr. Arruda. I'd like to come back to the reopening of businesses regionally. Yesterday, I was told that things went well, that there's a lot of business owners who are very ingenious and very resourceful. They've all set up all sorts of different procedures in order to be able to keep that 2-meter distance between both employees amongst themselves and between the employees and the clients. So things are going well. Very happy with this stage. I'd like to come back to the opening of schools and daycare centers in regions outside of Montreal, which is planned to take place on Monday. Once again, I make a call out to the flexibility of people. You heard the Minister of Education saying that the opening of schools is something that might take over a few days. And I would like for all Quebecers, all teachers, all and parents, that they put themselves in solution mode and not in I'm looking for things that are going wrong. We are doing this for the well-being of the children. My daily thanks are for our seniors in those residences. You'll see soon we're going to allow more visits, caregivers. We're going to allow residents to go out more, and I wish to say thank you. Thank you for your patience. Thank you for your understanding. And at the same time, let's be prudent for how things will unfold. But I understand very well that it is important to give you more freedom and to allow you to see people a little bit more. I would like to end by repeating a guideline that I'm going to be repeating perhaps for many weeks to come, perhaps even months: 2 meters, 6 feet. We must absolutely make sure that everybody, particularly when we are with people 60 and over, but generally speaking, to avoid the spread of the virus and to be able to, in Montreal particularly, to give ourselves the necessary leeway to deconfine things a little bit, that 2 meter, that 6 feet distance between people has to be respected. So I count on you. We need you to be able to get through this, to be able to get to the following stages.
We still need more staff in our health system. We're working on new bonus plan for the people who will come work full-time. Today, we're announcing gradual measures to soften the rules for our elderly. We know the situation is very difficult. Autonomous people have been isolated for 2 months now. We've imposed this for public health reasons. It's time to let them return to a more normal life. Of course, the virus is still there and we must stay very careful. Everybody will have to follow the rules and continue our distancing efforts. I'm counting on you all. Thank you.
Vous êtes prêt à prendre les questions?
Marguerite, excusez.
Marguerite. Thank you, Mr. Premier, Dr. Arruda, ladies and gentlemen. By wanting to protect our elders who live in residences, we have also taken away from them a lot of freedom of movement. We have cut them off from their loved ones. It was necessary to do so, but now the time is coming to gradually add flexibility to the rules, to give them back a more normal life, and to lessen psychological distress that is happening. I will let Dr. Arruda explain to you the modalities, but generally speaking, they will, as of now, be able to go outside without supervision. They will be able to see their loved ones. I'm also announcing that we've modified the framework that allows the caregivers to take care of their loved ones. As of the 11th of May, a caregiver who's significant in somebody's life will be able to care for the person that is close to them, except under certain exceptions, that it be in CHSLDs, in intermediate resources, the RIs, or the private residences for the elderly, RPAs, whether it be family-type resources, and when there are also where there's also children or people who have a disability, caregivers will be able to help those people. We're changing our paradigms. If an establishment wishes to refuse access to the caregivers, they will have to justify this exception with the Ministry for Health and Social Services. Caregivers will have to respect the infection prevention protocols and ease the life of the staff, but they will be finally able to care for their loved ones. And finally, one of the most sad consequences of this pandemic has been the people who leave without being able to see their families one last time, and the caregivers or loved ones who cannot say goodbye to somebody who has come to their end of their lives. For reasons of humanity and of dignity, we have decided to remove the ban on visits in palliative care. Visits will therefore be allowed in all living environments, regardless the imminent character or not of the coming end of life. You will be able to say goodbye to your parents, and parents will be able to say goodbye to their children or their spouses. To end with, I wish to say one thing that is very important. Flexibility, and it does not mean that we need to slacken. And as the Premier said, the word of the day is prudence. Let us be prudent, and I thank you. Hello, Mr. Premier, Madam Minister, ladies and gentlemen. On my side, I would like to give you a little bit more details on the exit plan for the residents in the residences for the elderly that has just been announced by the Premier and the Minister. It is important to remember that together with everything else that we are doing in the context of reopening or deconfinement, this permission must be gradual, and it is not, and I wish to congratulate the Quebec population for having respected the guidelines. And you know, our deconfinements are also going to be helped by the fact that people are not going to interpret that as being coming back to the life that we had before the pandemic. Social distancing, the protection of the elderly, all those remain important elements. But you know very well that confinement has impacts on everything, on ourselves in terms of, you know, whether we are young or not as young, or whether we are children or teenagers, grown-ups, elderly. But we know very well that the elderly are at a higher risk of problems. Non-stimulation, if they don't walk as much, their muscles don't perform as well, they're at a greater risk of falling. if they become less autonomous, they have a loss of independence from a cognitive point of view. A brain that is not, that is not stimulated shows atrophy of the brain. So it's important to be stimulated. And there are losses of social links that are very significant when you are older and you are in a state of greater fragility. Therefore, the confinement brings about, particularly in the elderly, a sub-stimulation and isolation beyond the cognitive losses and muscular losses brings about a lot of stress, a lot of anxiety, and even fear. So, in fact, we have to understand that now that we are aware, that people have understood that COVID-19 can be serious and that it can bring about many deaths, we believe that we can now allow our people reduce a little bit what we were doing in terms of confinement or preventing people from going outside, because autonomous elderly people, in my opinion, must be able to maintain their independence in what they have. It becomes crucial in terms of health. In order to reduce to the maximum the effects of confinement on physical and mental conditions, we are therefore going to add certain lessening. But I'm letting you know, as of all the other sectors, the measures can be reintroduced if ever there's a specific problem that shows up in any specific region. So that greater freedom, that easing for external visits without supervisions, as I said before, is going to be necessary to respect at all times, but under certain conditions. There cannot be cases in the residence where you are, because in that case, you could be in incubation, you could bring the virus outside. And it requires a respect of sanitary guidelines that are applicable to everyone. So physical distancing of at least 2 meters, that's 6 feet, that we're going to be repeating and repeating and repeating with other people who don't live with them. It's going to take hand hygiene when you leave the residences and when you come back. So wash your hands, wash your hands, wash your hands. We're going to ask people to wear face coverings in public places to avoid, particularly if they come into contact less than 2 meters away, but particularly we'll be asking them to wear them. And we must add that face coverings is together with the other measures like hand washing and social distancing. Generally speaking, as of today, we are withdrawing the obligation that walking outside be supervised. I think that our elderly, unless somebody actually needs somebody to help them walk as such, but somebody who is autonomous doesn't need a chaperone as of now to go have a walk outside. We're asking them once again to follow the same guidelines. We can now meet a resident. The families can meet them outside. And the weather is nice. It's not winter. But now they have to maintain a 2-meter distance, and visiting hours may be organized by the establishment to avoid any gatherings of anybody being outside. And people will be able to have an activity inside or outside if there's a physical social distancing that is maintained. So all that is in order to allow people to be able to go out for walks and maintain their muscle mass. As of the 11th of May, we will be setting up specific measures reserved for the elderly in essential businesses, as well as permission to go to them, like grocery stores, pharmacies, for people 70 and over. We've seen people at some point who were even refusing letting people in. That is over. And we will reserve specific periods where we'll be making sure that there are fewer people and that they are less exposed to potential risk. The new applicable measures vary according to the category of RPA, for example, whether they are independent, semi-autonomous, or regionally, if ever there's outbreaks. But right now it's being done everywhere. We wish to thank the owners of RPAs for the very close collaboration to respect the guidelines. I think that the owners, and perhaps this is all a change for them, and the other tenants as well, because some people had a lot of fear when people were going out. But I think that's where we are. The impacts on health are much too great for us to keep doing this. And I think that hygiene rules and distancing will have to be favored, particularly by the owners of RPAs, and there may also, to help us in the case of epidemiological investigations, if ever there were outbreaks, there will be, a registry of people going in and out. So that could really help. So this is a new stage. We know that it will have positive impacts on people's health. It will probably have an impact on their physical health and their mental health, and it gives a bit of hope, I think, to everyone with the spring that is coming back to us. But once again, in a perspective where I would tell you that there are some issues. We'll follow the evolution very closely, and like everything else, like I've said, what is true today can be different tomorrow, but for the time being, let us try. If everybody collaborates, the probability of us having to go back is much lower. But if people don't respect the guidelines, it may become an issue. I would like to also add, together not with what I'm saying now, but something else, and Mr. Premier, you are not even aware, you're going to learn at the same time. You know, the administrative territories and the sanitary territories, these have been, decided that we're not done according to the epidemiological, of the coronavirus. Like Montreal is a certain group, but if ever we realize that in the local epidemiology that there's a certain zone that looks like either the Montreal zone, it could be extended, because we heard about Joliette right now, that there are worries about the reopening at the same time as the others as such. It is possible that we emit different recommendations, not because it's one city rather than another. It has to do with the epidemiology, that's all. I just wanted to let you know, because there are probabilities that perhaps, the Montreal metropolitan area be adjusted with the epidemiological information of the past few days. So I don't want to say that it will be the case, but when we have the epidemiological data to justify changing the category of a territory that was considered to be cold, but that is now potentially, more of a hot zone, we will be readjusting our data. And we've always said it. This is a daily analysis that we do of the data. Thank you. Thank you to all three of you. If you're ready with the questions, we'll start with the French ones. With all the announcements of deconfinement of the past few days, I believe that there's perhaps a lack of certainty or a zone that's not quite clear. On Saturday afternoon, can I invite people over in my backyard if we keep our chairs 2 meters away? Well, listen, as I told you, right now still, but it's coming, if you'll allow me, we want to go step by step. We want to avoid gatherings. And we know, and I'll tell you, and I'll explain to you why. And since we are deconfining many things, we have to be able to measure what is happening. Nature being what it is. It's not that people aren't nice. It's the natural thing. If we put 2 or 3 families together and they're having, dinner around a barbecue, there will be more frequent contacts. The probability is much higher because it's hard to maintain the 2 meters. I don't know if you know what I mean. In the street, it's easier, when you just, see somebody. But a gathering, I'm sure that I would want to, give a kiss to my son, even saying it's okay. But so for the time being, no, but it will come. Let's not get discouraged. That is what I want us to say. It's coming. Let's not get discouraged. But let us at least measure the effects already, because many are saying that we're going too quickly, There's all sorts of comments. Give us a time to measure the effects of what we're setting up, and then I'll ask you to still show patience. And I'm the first who feels like having a barbecue outside 2 meters distance from anybody. And I know that 2 meters is not that easy in a context of a meal and of gathering. That people see one another in front of a home or in the parking lot 2 meters away, that's one thing. But a gathering for a meal is quite different.
Madame Blais, c'est votre 3e mandat, si je ne me trompe pas, comme ministre responsable.
Madame Blais, this is your 3rd mandate, if I'm not mistaken, as Minister for the Elders. With a bit of hindsight, what could you have done better or more in the past? Of course, not to avoid the crisis, because we can see that it has happened everywhere, but perhaps to diminish the effects and mitigate. Well, as I said in a preceding government, I would have wanted to have done more concerning the CHSLDs, but it was in the Ministry of Health and Social Services. When I arrived with Mr. Legault, we had a plan, and I wish that we could have gone faster. That is to say that I wish we could have been able to implement that plan, which was, amongst others, the new model of housing for our people who, generally speaking, CHSLDs, 80% have major cognitive problems, neurocognitive problems, to redo our CHSLDs 25 that we want to refurbish, having had the time to file the policy, the first policy for care in long-term care facilities and a policy for caregivers. We invest more to maintain people at home, and we'll have to do it. Restructure, basically, these living environments. We can see it right now, how difficult it is. So this is a very important moment to be able to go even faster, to really go into high gear, to rethink these environments and take each of these stones and flip them over and fit them differently. Even before the pandemic, we were missing staff in CHSLDs, but now we can see that there's staff missing because people are sick and all sorts of other reasons. So the Premier is still making a call for people to go to Je Contribue. We need those people. We need more staff. So we're going to have to change our way of seeing the people who work in those environments. We have to pay them better. He had announced this. We have to give them better working conditions as well. I want to say something as well because I get emails. When we have press conferences live like this, we can say things sometimes that can hurt certain people. And, we take examples and people think that we are putting them in categories. But I just want to say to my wife and to my boy and my daughter that I said I would kiss my son, but I would also kiss my wife and all three of my children. I don't think that they would have reproached me, but I was told, it was reproached to me that I was becoming almost schizophrenic or psychotic because I always spoke about masks and washing the hands, and some associations who defend those people who were affected. So if ever in press conferences, I take examples that could hurt anybody, please be assured that I apologize. So it's said, and I just want to tell my family that I love them. Sorry. Very duly noted. Following question. Well, hello to your family, Dr. Arruda. Since you've announced that caregivers could go back to resources in mid-April, I think it was, if I'm not mistaken, how many of those caregivers were able to go back? And, Madam Minister, you're talking about a new paradigm. What are the exceptions that will be accepted by your ministry to be able to refuse? You're talking about the 14th of April guideline where we had allowed significant caregivers to go visit their loved ones in CHSLDs. We realized that the guideline was not welcome the same way, depending on the establishment. So some establishments refused for certain reasons. They wouldn't let caregivers in, also because there's a lot more difficulty. You had to welcome them. There have to be people there to accompany them. But when we say that we're changing paradigms, it means that every living environment are going to have to let caregivers in. And if for one reason or another the establishment wishes to not follow that guideline, they will have to let the Ministry of Health and Social Services know. And they will give their answer. A kind of a technical element. Let's say that somebody does not respect the guidelines. Or has a behavior that are inappropriate. We want to give ourselves the leeway if there's a specific situation in some kind of unit that there is too active transmission. But as Madame Blais is saying, is that we are reversing the burden of proof. So it's for everyone except in exceptions, and then each situation will be analyzed. Mr. Premier, we know you tend to want to hold people accountable when they make errors. In the context, we've seen many cases of, let's say, delinquency on the part of CIS or CIUS or others that have not protected their employees. Are there directors or CEOs that are going to be losing their jobs at the end of the crisis? Well, listen, this is a process that is continuous. That of making sure that we have CEOs in CIS and CIUS that are competent. In the past year and a half, there's already been a lot of changes that were brought. There will be further changes coming up. I think that this is a continuous process. Perhaps, yes, in the crisis, we sometimes may have we can have certain lacks or, certain changes to fill them, but it's continuous. And I want to make sure that in ALCIS and ALCIUS, because those presidents have a lot of responsibility, amongst them the responsibility of CHSLDs, I want to make sure that those that don't have the management skills that are required will be replaced.
Maintenant, au tour de Tommy Chouinard, La Presse.
Bonjour. D'abord, Monsieur le Premier ministre.
Mr. Premier, I'd like to get back to your new call out for reinforcements. You're using the image of war a lot. Why don't you use conscription? Because it's an image, of course, of war, but, there's a state of health emergency and you have the power to reassign the state staff where you want, using your own conditions. Why don't you use that provision? Do you fear that there will be? What we always want is to have people who feel like going to work with the elderly and who are vulnerable, who are ill. Forcing anybody to go work with patients or residents who are undergoing difficulties, I don't think that it should be the first choice. Now, what I'm saying is perhaps it's one weapon that we have left, would be improving the wages. For the time being, as you know, we are negotiating with the unions to be able to improve the wages of orderlies permanently. But what I've asked the President of the Treasury is, in the short term, for the next few months and weeks, can we improve the wages to entice and motivate and mobilize people to come and work in the health network? I prefer that to drafting. You're announcing today a new step, as Dr. Arruda was saying, in the deconfinement. And this time, we're talking about people who live in RPAs. You indicated criteria to be able to get to that stage of deconfinement. What I'd like to know, what are the indicators that you are using to determine at one point or another, not that we wish it, but that there is a need to reconfine? What would be the indicator that would signal to you that as we go along, because you're saying that you're going to follow the situation very closely, what indicator are you going to use to determine that we have to go back to mandatory confinement? Well, maybe I will let Dr. Arruda. It will be, yes. Yeah, I can go? Yeah. Well, complete. No, do you want to complete first? No, go ahead. Thank you, Mr. Premier. It's going to have to do with the observation of outbreaks that could be attached to the measures that we're setting up. If we realize that there is a lot of outbreaks in school environments, there could be one, but that there really is a transmission that they go into the community from the school system, we might go back. If in RPAs we realize, because now I wish to say, this is not deconfinement, this is an easing of the measures. I do want us to make that distinction. We're opening things up a little, but, we're letting people go out. We're not deconfining entirely. We're not saying, go have a day outside and go shopping all over the place. No. So we will have to analyze the epidemiology. Are we going to have an increase in hospitalization rates, for example? The cases, as we test a lot, we will have more cases. We have to understand that now cases, when we take the criteria of a number of cases to be able to deconfine, well, all we'd have to do is stop testing and we'll get to the number that we would wish to get. It really is hospitalizations as well as people who are in intensive care. But before we get to that, it will be the analysis of what we call the clusters, cases that are associated to contacts and for which we believe that we might lose control. And then we'll see what the behavior is. If it's something that was generated by a work environment, it's different. If it's something, because people want to walk around in the community, well, that's a different matter entirely. Hello to all three of you. Mr. Arruda, you said earlier on that the elderly will be able to go to essential essential businesses as of the 11th of May under certain conditions. I would like for you to explain that further. What do you mean by that? Well, there'll be specific schedules to allow them to go, to be sure that, taking into account that it's a higher risk clientele to catch diseases. As of the 11th of May, we even suggest for RPAs that may have to bring people to a certain distancing that there will be time slots that will be kept for the elderly in essential businesses, depending on, certain time windows. And there are modalities that will be defined as well, because we can sign that guideline centrally, but after that, operationally, owners have to be able to take the measures, and there will be guides that will be given to them. I'm sorry, I hadn't finished my question. Oh, I do apologize. I was going to say, because you're talking a lot about RPAs, you're talking about CHSLDs and residences, but people who are older, but who are at home, and who have been following the guidelines since the beginning, and who feel that they've been forgotten in all this, and who would like to see more people, go out a little bit more, but who are 60 or 70 and over. But I think that they're going to be treated the same way. We're talking about the residences for seniors within a perspective where, we confine them quite a bit, whereas people who were living in their own homes perhaps decided to stay home, which is good, but they will be able to do the same kinds of activities as the others. I think that there is nobody that asks that they be supervised as well, because, supervision sometimes depends on the autonomy of the people. But now I think that, all people, all elderly people have to, be able to do it. We're asking them not to gather. We're asking them not to let their, grandchildren come over to their house, but their live in society can come back a little bit more to what is normal. They have to respect the 2 meters. They have to wear a mask ideally when they leave. That's what we recommend. I would perhaps like to add that we saw that in certain residences, guidelines sometimes are interpreted differently. So supervision was done in the garage. The elderly would walk in the garage. That's not a place. So that's the reason why we also have to let, people go out, people who are 70 years and over. And at some point, sometimes, that wasn't so long ago, we didn't perhaps know the virus as well. Now we know the virus a little bit more. We know the seriousness of it. We have assimilated the social distancing measures, also the hygiene measures. So I think that we're there, because otherwise it's going to cause a lot more psychological problems and mental health problems. Mr. Legault, this week, although teachers were added to the list of emergency staff, all sorts of teachers did not have any places in a daycare this week, and we think that next week a lot of people who are supposed to go back to work and who should have access to daycares won't have room in daycares. What will those people do if they can't go back to work because they have children who are 1, 2, 3 years of age at home? What should they do? Well, when I was saying earlier on that we need to have flexibility, that's what I mean. This week, technically, the daycare centers, the only increase that we made was for the teaching staff. Next week, there will be a much greater reopening regionally for all daycare centers. So that should allow us to fix most of the cases of teachers that haven't been able to find any spots for their child in daycare. So this will be done gradually. Even in schools where we said, we could do it over a 3-day period, I think that we will find solutions to these problems.
Monsieur le Premier ministre, Madame la Ministre, Monsieur Arruda. Madame Blais, vous avez dit...
Ms. Blais, you said recently that we had to take collective responsibility for what is happening in CHSLDs. You targeted the labor organization for the past 20 years, the wages, etc., for the way things are going in CHSLDs. You were named as a minister for the elderly in 2007 for the first time. When did you start denouncing this situation? And in the governments in which you have worked, were you hindered in any way to prevent you to improve the situation that you had noted at the time? First, I will also take my own responsibility. I am accountable. I am, the Premier apologize in the name of the government. I am a member of the government, and I do take my share in responsibility. In a previous government, I was pretty hindered with everything having to do with the housing environments because it was the responsibility of the Ministry of Health. That doesn't mean that I did not go to those environments and that I didn't see and that I did not speak. But it takes governmental will. It takes a lot more than one person who's talking about those living environments, since there's an entire economic issue surrounding this. As you know, I stopped with politics and I came back. I came back because I discovered a man who felt like changing things for the elderly. CHSLDs have always been the poor in the Ministry of Health and Social Services, and it's time that it changes. It's been 20 years that we've been talking about it. Even Ms. Marois, in an article, mentioned that it was all governments, to a certain extent. The previous governments that did not act substantially. When a government announces that it will build 2,500 spots, 25 CHSLDs develop 2,600 new spots with $2.6 billion, invest for this year $380 million in extra to keep people at home. When the government decides that it wants to support caregivers and when the government decides that it wishes to increase the wages of orderlies, because those wages made no sense, they take care of the most vulnerable, it's because there's a will. And it is the will of the Premier of the Government of Quebec, and it is also the will of the colleagues, the President of the Treasury Board, the Minister for Finance, for the economy. Yes, we need money to change the paradigm, to change the machine, to, steer that big boat towards a different direction. But it's something that we're doing, and that's why I'm there. And this situation that we're experiencing internationally, worldwide, should I say, but that we are experiencing in Quebec quite a bit right now, is making it that we'll never be able to go back. And with the government of M. Legault, we will go even faster, and we will be doing things correctly. I just want to come back to something that you just said. At the time, you had left the cabinet of Mr. Couillard, and it was in a period where there was a certain financial austerity. Do you think that CHSLDs were the victims of austerity of certain governments that they imposed? Quite. When I say that CHSLDs were the unwanted, the unloved, it's because we left those environments. There are some CHSLDs that are 25 years old. CHSLDs where people, there were 2 per room, 3 per room. I've visited some of these places. So it is normal that the infection spreads more quickly. We can't isolate people as much. We were forced to develop red zones and hot zones, cold zones, buffer zones within those environments. That doesn't mean that all CHSLDs in Quebec are dilapidated or obsolete, but there are many. They have to be, rebuilt, but differently. They can't be hospital-centric environments anymore. They have to be living environments. We're talking about living environments, but are CHSLDs really living environments? I'm asking the question and I'm giving you the answer at the same time. But for that, we need to have staff as well that is well paid. And we have to offer working conditions to that staff, because the people who work in our facilities also have families. They have to be able to predict their lives. There has to be predictability in terms of work. Thank you. Further question?
Madame
Blais, I'm going to go along with what my colleague just mentioned. You did a tour of CHSLDs. You went to see them all. Do you regret not having acted quickly enough to give a bit of breathing air? Because it's all nice to build new buildings, but what's missing are people, hands. There's still hands missing today. We're looking for people. About 20 years ago, in our CHSLDs, the population that was housed there did not correspond to the population that is there today. It's truly the people who are the most vulnerable. I mentioned it, 80% of the people who are housed there have Alzheimer's disease, Parkinson's, neurocognitive problems, severe ones. The people who work in those environments are missionaries. We're looking for missionaries. And for that, the Premier has said it often. We need to offer them working conditions, particularly for the orderlies, working conditions that are going to make it that we can retain our staff, and also offer them permanent positions. We need permanence. And one of the things that happened in the Greater Montreal area, I would say, in the case of COVID-19, is that we need dedicated staff. We can't make it that the staff goes from one establishment to another. We need dedicated staff, dedicated to one place, and we also require autonomy in terms of the medical material, and that we are working on because we need the medical material. If another virus comes, we'll be ready to be able to face it with all the material and the dedicated staff, establishments that will be modern, and we will truly work ahead of time because the key to success is maintaining the services in cities, in the villages, and the homes of Quebec. And Mr. Laforêt, the way that I see the situation is that CHSLDs were underfinanced for many years. When Marguerite Blais accepted my invitation to come at the CAC, we took the commitment of better financing CHSLDs. In the budgets for the past year and a half, we have increased significantly the funding of CHSLDs. However, where I take responsibility, as well as our entire government, is that we let many positions that were posted and that remained unfilled in CHSLDs, unfilled for wage reasons. And what we had told ourselves at the time is that the collective agreements were coming to an end on the 31st of March 2020, and that in the bargaining of the new collective agreements that would start on the 1st of April 2020, we were going to improve the wages of the orderly, amongst others, in order to be able to fill those positions. If I have something to reproach myself with, and it's not Marguerite, it's the entire government, including the finances, the treasury, the health and social services, was to think, well, should we have increased the wages before the end of the collective agreement? I think that perhaps that is where, if an error was made, that's where it was made. It was to not improve the wages more quickly. And, I'm telling you that we are having intensive negotiations right now to improve the wages of orderlies permanently. There are also bargaining that are going well with certain unions and others not going as well with others. I hope that very soon we'll be able to get to an agreement with unions to better pay our orderlies. And as I've said before, if we don't get there, we will do it unilaterally. A government has all the powers of increasing the wages of certain groups of employees with or without the support of the unions.
Dr.
Arruda, there are statistics that have disappeared, and they're rather important for today to understand the situation. In the number of residences right now, CHSLDs, RPAs, how many COVID cases are there? How many residences have COVID cases? How many residents are infected right now? And how many people have died outside of CHSLDs? Because you often say that it's mainly CHSLDs, these people are more vulnerable, but those numbers have disappeared. So I'd like to repeat how many residences where there are cases of COVID-19 right now out of the 2,600. How many residents are infected and how many deaths outside of CHSLDs, please? Right now we have 306 residences that have cases of COVID-19. 4,804 residents that are infected with COVID-19 right now. And I am the one who asked to remove the chart, not because that I want to be transparent, but because the data wasn't good on the residences that have more than 15% of residents who have confirmed cases. There hasn't been an update made for the cases that are still active. So we're working on it. I've been told that at the very latest, at the beginning of next week, we should be able to update these numbers. And as soon as I have the numbers, we are going to make them available. And we are going to be completely transparent. It's just that for the time being, the update has not been done in the residences for as far as the percentage is concerned of COVID cases.
Oui, bonjour. Deux précisions
Two clarifications concerning the return of caregivers. First, is it applicable to hospital centers where there are people who may be hospitalized for a long period of time, whether it be linked to COVID-19 or not? Are they going to be able to have the visits of caregivers in the hospital centers? And what about the protective equipment for those caregivers? We know that we were very close to not having enough equipment. Are we sure that all the people who are going to be going to the residence are going to be protected? Is there a shortage? Well, we're talking about caregivers. We're talking about somebody significant. If we're talking about CHSLDs or RIs, it's the person who comes regularly. It's not somebody who comes and visits every once in a while, every 6 months. It really is a person who comes to feed the loved ones, to give them, tenderness, affection, to take care of their hair, to spend a bit of time with them. And as you know, in CHSLDs, it's 10% of families that visit the people who are housed there. So out of that 10%, it's not perhaps the entire 10%, but it's a part of the 10% of those caregivers that will be able to go to CHSLDs. As far as hospitals are concerned, perhaps I'll let Aruda answer. Well, the rules for visits are going to be applicable as such. I believe that in a care environment, the staff manages to give care, but I imagine that it will be within a perspective of usual visits, and if ever the people are infected and have to be visited, there are protocols, for the clothes that have to be worn, etc. I'd like to continue by saying that Dr. David Lucier, the geriatrician at the University Institute of Montreal, will make a video where he will be explaining how one protects oneself when one goes to visit their loved ones in a living environment. And he'll also be explaining how to prepare yourself psychologically, because there are perhaps certain loved ones that will go into CHSLDs, and the situation will be very different from what it was before COVID-19. So we also wish to prepare those people, and that video will be accessible. Mr. Premier, you renewed you made another call out to Quebecers to help out in CHSLDs, and yesterday you were talking about the presence of 350 soldiers who were deployed. And about 2 weeks ago, when we had talked about the Army for the first time, if I recall correctly, we had expected that there'd be a lot more soldiers in that. We talked about 1,000, if I recall correctly. Are there particular problems? Have there been obstacles? How come we didn't get to that number? Well, I think the question would have to be asked to the federal government or the Canadian Armed Forces. We are quite ready to welcome them as quickly as possible. We were told that another 250 should be able to come soon. But for the time being, we've never had any confirmation about the 1,000. It could be faster. We will now go to English questions.
Good day. For Mr. Aruda, we're just looking at some numbers in Montreal again. We now have 6 boroughs with more than 1,000 cases in the Montreal area. Can you tell us? Can you update us on what is happening with with the number of deaths and the number of cases that are still going up?
You want to know exactly the number of deaths in Montreal?
Yes, and then do you have an explanation for why this is continuing?
Okay. I just want to give you the number of deaths exactly in Montreal for the last 78. 78 yesterday. In fact, it's related, and it's really related to, I would say, what is going on in CHSLDs. In Montreal, the outbreaks have been driven from what we think actually. First one have been driven in the first part from through travels coming back, especially from New York, with some outbreaks that happen in certain communities. Afterward, there was, I would say, the CHSLD's issue with probably workers, health workers who were working in different CHSLDs that probably introduce or get the disease from one center and spread it through, I would say, certain CHSLDs in Montreal. And that is explaining, based also with the fact that now we know that people can be contagious 6 days before getting the symptoms. That makes, I would say, a perfect situation where there is elderly people, very sick, especially the ones over 80 years old, 70 years old, people, and with, I would say, the problem with staffing in CHSLDs that promoted, I would say, infections that were expanded in those settings. We are now analyzing is there a lot of transmission in the community in Montreal? I think there is perhaps some, I would say, but in relation with those outbreaks and with those trips that have been from New York, especially in Montreal from New York.
And second question for Mr. Legault. There seems to be confusion with what's happening in the high school academic year. I don't know if you're able to answer this, Premier, but I'll try. Can you clarify, do students have to do the work that is put on the École Ouverte website, and will they be marked on this work?
Okay. First, starting next week, all services will be given for children of teachers, so they will have all the time to get more in contact and do some work with the students that are at home. And we expect also that the students ending their high school, that they'll be able to go to the college. So for the people coming back to high school, we may have a part of the work that will be done in September, but for the one ending their high school, we want them to have the opportunity to go to college.
Thank you. Cathy Sonnet, CBC News.
Good afternoon. There was confusion when the measure about caregivers was announced mid-April. What forced you today to change the rules? Was the confusion or the fact that you heard so many stories about elderlies dying alone in Quebec?
Yes, you're right about this. You see, we put in the balance what was the best for the people, for the population, and the best right now, it's to give the right to the caregivers, the significant caregiver, to be able to visit the person who is living in a CHSLD or RE or RPA or whatsoever, you know, les milieux de vie, and to be able to be there, because there are some people who are dying without seeing their lovely, and this is unhuman. So that's why we are in the week of santé mentale. So I think it's about time that we take care also of the caregivers and the people who are living in this milieu de vie. I don't know if Dr. Arruda wants to say something else, or the Prime Minister.
What I would say is that on April 14, what we announced is that people responsible for residences, if they thought that it would be good to have some caregivers coming and helping them, that they can do so. Today, what we announce is very different. We say all caregivers, they have the right to see their people in those homes. And if residence management refuse, they will have to justify why. So we're really changing. We say now you have the right to see your people. All caregiver must be welcome, and if they are not, we want to know why. So it's different. At the time, it was more a question of coming to help residences who wanted to have this help.
But some were refused, so we knew
that. Yeah, we
to
saw that many thought that it would be more trouble than helping them to have those caregivers coming.
And in fact, we wanted the same thing, but the observation was making that doing it that way, it doesn't work. And I just want to also say that, there is kids who are actually on DPG or on different families who haven't seen their parents too. We want to make sure that you understand that the kids could and the parents could get access to their kids to visit them also. I think Dr. Karma is wants to make sure that the kids and the ones who are have déficience intellectuelle or autism or other kinds of troubles can be in touch with their family. So I just want to make sure that people understand that when we talk about RPA and RTF, that includes also the youngs that wants to see their parents and to keep a contact with their family, even if they are in a house elsewhere.
And for seniors in private residences, you're evaluating the risk, the dangers of COVID-19 versus the risk of feeling and suffering from solitude and sadness. There are concerns that perhaps that goes too far. You'll see. But do you fear any backlash if you have to go back, or what it was for almost 2 months for them?
We are observing the impacts on physical, mental health, stress, anxiety on elderly persons. That's the case for even our young adults and kids and teenagers. Everybody is upset with being confined. You cannot confine everybody for a long time. There is studies made about the brain changing. There is data which is not only the infection but also the impacts. The balance, actually. First of all, people understand that COVID is a serious thing. I think that in March and April or before, people were not aware. We had not those people dying everywhere. So I think the people are intelligent. I believe people are intelligent. People will respect the way of doing business. So I think based on the balancing of mental impacts, we had people who even stop to eat. They want to die. They don't want to be in that situation. There is some suicides that could happen. So I think this is worse, I think, than letting people go a little bit outside. And we cannot be confined for... Everybody's going to get crazy if we keep that for months. And elderly people will lose their autonomy, especially the ones who are autonomous, actually, because they are not stimulated.
Thank you. Samuel Pouliot, CTV News.
You said it a bit in French, but are these new rules also going to be applied for elders who are over 70 and who live on their own, in their own homes? Will they be able to go shop and go outside?
Yes, the rights of all the people will be the same independently where they live, unless there is an outbreak. If you are sick and you have COVID-19, you're not supposed to go outside. But if you're in good health, you can go as others will go.
Okay, and on another subject, your order to limit the distribution of Ventolin, the popular asthma inhaler, is worrying some patients. Is there a risk that comes with changing medication in the middle of a respiratory pandemic?
I'm sorry, it's not really my the thing is that we change the Ventolin.
Yes, there's a distribution limit.
Okay. Well, look, I could perhaps try to have the answer of the question for tomorrow, consulting my people. But I think it's probably because of supply issues that they will prefer to make sure it's going to be used. It's a medication that is a lot used. Probably you are keeping him for the people at more risks, and probably it's why there is, because of the supply, a certain caution. But as soon as it come back normally, I think the normal situation will come back. But I can make verification and even send you a mail if you want to have the information.
Thank you. So 2 last questions sent by Raquel Fletcher, Global News. The World Health Organization is urging countries to check their records for any suspicious early cases after reports that France had a case of COVID-19 in December, nearly a month before the country confirmed its first case. Is Quebec investigating or planning to investigate suspicious early cases?
Yes, we will. And also, one thing that we're going to do is we're going to look retrospectively, and I think it's a good thing to look at what was the levels of people dying in December, January. We're going to compare the excess of deaths that comparing to other years before, and sometimes those excess deaths are an indicator of people. And I would say also that it's going to be a way to best compare one country to another one, because based on surveillance systems could be different, or the testing capacity could be different. When we're going to look back at the death rate in exactly from one period to another one, we're going to see if there was excesses that have not been taken into account by our systems.
So one very last question from Raquel. Why have statistics concerning infection and death in long-term care been taken down? Is there a dispute over the accuracy?
No, it's because right now we're checking the cases that are still active, because we put the number of confirmed cases, but we know very well that either some are dead or some don't have the COVID-19 anymore. So we're cleaning the data, and as soon as we'll have it, we'll give it to the public.
So thanks for all your answers. Merci, c'est ce qui complète.
This puts an end to this press conference. See you all soon.